We have conducted a phase 1 now expansion study combining a drug that to date has never been tested or shown activity in myeloma called Ruxolitinib. It is a JAK inhibitor in combination with the immunomodulatory agent Lenalidomide and an oral steroid not widely used, but a steroid indeed, Methylprednisolone. The work in this study was based on a lot of preclinical data that we and others have derived over the last several years, showing the ability of the Ruxolitinib to both overcome resistance to lenalidomide through particular mechanisms within the cell that is able to block lethal lenalidomide resistance. In addition, we've shown that the drug Ruxolitinib has a lot of different other mechanisms of action, such as reducing cells that are quite immunosuppressive and reducing proteins on cells that shut off the immune system. So that led us into the clinical trials arena, where we conducted a phase 1 study with extremely low doses of Ruxolitinib and lenalidomide initially, because both drugs can be quite myelosuppressive, although reversibly so. But we were able to go all the way up to the top cohort using the lenalidomide at 10 milligrams daily for 21 days with Ruxolitinib at 15 milligrams twice a day. And we use Methylprednisolone at 40 milligrams every other day orally because we believe it's better tolerated than dexamethasone, which is the standard once a week in terms of mood and tolerance. This study has now moved widely into a bigger study because of the effectiveness shown in the first phase, in which about half the patients demonstrated response to that triplet, and those were patients that were totally resistant and refractory to lenalidomide and methylprednisolone. We are now testing actually lenalidomide less, that is without lenalidomide, just Ruxolitinib with methylprednisolone as a doublet to see if in the absence of lenalidomide, the doublet will have activity, and those studies are ongoing. The hope is to further expand this study and with the promising data to do a registration trial in order to get this FDA approved, and those plans are now in place to make that happen. We're very encouraged, and not only encouraged by the high activity, but the unbelievable well-toleratedness, not that that's a word, among patients getting this regimen. Ruxolitinib is a very well-tolerated drug, and we've seen little impact on blood counts even at the higher doses that are now being used and continuing to be used in our patients who are being enrolled on the trial.